Varela. I'm going to do a head to toe physical assessment for New England Tech. I have already washed my hands and taken my patient's vital signs, and I'm going to grab her from the room. Now I'm going to provide privacy. Hi, Mary Rose.
Hi.
How are you?
Good. How are you?
My name is Wilma Varela. I'm going to be your nurse for today, and we're going to do a head to toe physical assessment, okay?
All right.
All right, but first, can I ask you a few questions? Can you verify your name and your date of birth for me?
Mary Rose Waters, 7/14/94.
Great. And do you know why you're here today?
To get a physical.
Okay. And what time was your appointment?
2 o'clock.
Okay. Knowing this, I noticed that my patient is alert and oriented times for place, person, situation, and time. And I'm going to grab your weight and your height and your BMI. So just come with me. Just step on the scale for me. Okay, and if you can turn around and I'll get your height. Okay. And your BMI today is 35. I'm just gonna get your waist circumference. Okay. Just 2 hands up. All right. Now we can walk back to the room. All right. I'm just gonna ask you to walk on your heels, on your toes, and then heel to toe. All right, great. And before you sit down, we're gonna do some more exercises. I'm gonna provide privacy again. But first, I'm gonna check for your Romberg's test, okay? I'm gonna ask you to place your hand to your side, close your eyes for about 30 seconds. I'm gonna be right behind you. Okay? And my patient is negative for the Romberg's test. I'm also gonna inspect my patient's I'm gonna assess for kyphosis, lordosis, and scoliosis. Okay? I'm just gonna ask you to bend down. Just gonna palpate for symmetry. And for symmetry of the pelvis, and you can see it. And my patient is negative for kyphosis, scoliosis, and lordosis, and I also check for the symmetry of the pelvis, and it's symmetric. Okay, and we're gonna do some more exercises. I'm gonna ask you to roll your arms, your wrists, and lift your arm up and down, and your legs up and down. Okay, roll your ankles. Okay, and then press it down. Okay, and squeeze my fingers. Great. Okay, now you can sit down. Okay. All right. And I can already inspect. I'm gonna inspect the head and the neck, and her eyes, nose, ears, and mouth, and trachea look symmetric. Now I'm gonna inspect her hair for any infestations, abnormalities, or lesions. I'm gonna palpate and inspect. And her hair seems even throughout. There's no lesions, abnormalities, or infestations to the head. And I'm gonna palpate the pinna for any tenderness. If there's any tenderness, no. Okay. And I'm gonna check the ear for any drainage. And there's no drainage. There's also no drainage here. And if I had an otoscope, which we are not using for this video, I would pull an adult's ear up and backwards and check the tympanic membrane, which would be a pearly gray color and translucent. And for a child, we'll pull it down and backwards. Okay. And now I'm gonna check for the symmetry of the eyes, and I already noted that the eyes are symmetrical and the sclera are clear. There's no redness. I'm also going to check the conjunctiva, and it's pink. There's no redness. Okay, and now I'm gonna check for the extraocular eye movement. Okay, can you just follow my pen light?
Yeah.
All right. Okay, and now I'm gonna check for perla. Okay, so just look straight. I'm gonna shine the light in your eye. Okay. Alright, and my patient's pupils are equal, round, reactive to light and accommodation. Okay, and I'm going to also inspect the nose to check for any drainage. Okay, and I'm going to ask you to cover one nostril and blow out of the other one so I can check for any deviated septum. And there's no deviation there. Okay. And before we go to the mouth, I'm gonna ask you to do some silly faces for me so I can check for the cranial nerve 7, okay? So first smile for me, then frown, and then wrinkle your forehead, puff up your cheeks, and stick your tongue out, side to side. Great. And her cranial nerve 7 is intact, okay? Now I'm gonna check if do you wear any dentures?
No.
Okay. And I'm gonna put my gloves on and inspect the mouth. Okay. I'm just gonna have you say ah. Okay, and the uvula went up and backwards, and also I noticed that all her teeth are intact. Her soft and hard palate are intact, and the mouth is moist and pink, and her lips are also moist and pink. There's no cracks to the lips, and I noticed no lesions or bruises on the face. Okay, and I'm also going to palpate for the thyroid gland and check for symmetry of the trachea. And the trachea is midline. I'm going to palpate. And the thyroid gland is not enlarged. Now I'm also going to palpate for the lymph nodes, starting with the pre-auricular, post-auricular, submaxillary, and subclavicular, supraclavicular. And I'm also going to check for this skin turgor here. Okay. All right. Now I'm going to do your respiratory. First I'm going to inspect, and I can already tell there's no bruises, lesions, or any abnormalities to the anterior thorax. And now I'm going to palpate. And there's no masses or abnormalities as I palpated. Now I'm going to percuss, and when I percuss, I should hear resonance when I percuss. And I did hear resonance as I percuss. So now I'm going to auscultate for the long sounds. And I'm going to ask you to take a deep breath. All right, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And her lung sounds are clear. And I'm going to go to the posterior thorax. And first I'll start by inspecting, and I can already tell there's no lesions, bruises, or abnormalities to the posterior thorax. And I'm going to palpate for any masses. and there's no masses. Now I'm gonna percuss, and what I should hear again is resonance. And there is resonance. And I'm gonna auscultate for long sounds bilaterally. Take a deep breath. Deep breath. Deep breath. The last one. And her lung sounds are equal bilaterally. Now I'm going to do the tactile for Midas, and I'm just gonna ask you to say 99 as I move down.
99, 99, 99.
And the vibration diminished as I went down the back, so that is normal. And last, I'm going to check for the thoracic extension. I'm just gonna ask you to take a deep breath. And my fingers moved apart as she was breathing, so that's normal. Okay, now I'm gonna ask you to take your shoes off, and then we're gonna lay 45 degree at a 45-degree angle, so we can do the cardiac. And first I'm gonna ask you to look to that side. Okay, I'm checking for any jugular vein distension, and I see no jugular vein distension. Jugular vein distension. And I'm also going to listen for any bruit at this time with the bell of my stethoscope. And I heard no swishing sound, so there's no bruit there. Okay, and now I'm going to I have already inspected. There's no lesions, abnormalities, or bruises. And I'm going to listen to her heart sound. Okay, first starting with the right of the sternum at the second intercostal space is the aortic. And the left of the sternum at the second intercostal space is the pulmonic. Third intercostal space, earth point. Fourth intercostal space, the tricuspid. And fifth intercostal space at the midclavicular line, that would be the mitral. And I will also listen here for 1 minute if I were to listen to an apical pulse. And I'm gonna turn my stethoscope and listen with the bell to the mitral, tricuspid, herbs, pulmonic, and aortic. And I heard no murmur, which is good and normal. Okay, now I'm gonna check for all of her pulses, starting with the temporal. Thank you. Carotid bilaterally. Brachial. Radial. And while I'm here, I'm going to check for any clubbing of the finger. And there's no clubbing. And I'm going to check for a capillary refill. And a refill less than 3 seconds, so that is normal. In less than 3 seconds. All right. And we're not doing the femoral pulse for this video. We're going to do the popliteal, posterior tibialis, dorsalis pedis, and we're also going to check for the capillary refill in the toes, and a refill less than 3 seconds. Okay, and while I'm here, I'm gonna do the Babinski reflex. And my patient is negative for the Babinski reflex. And I'm also gonna ask you to press down my hands. Good. All right. Okay. Now I'm gonna, do you have any nausea or any vomiting today? Okay. So I'm gonna place the bed down, the head of the bed, so we can do the abdominal.
Okay.
That all right?
Yeah.
Okay. I'm just gonna ask you to pull your shirt off. Okay. And by inspecting her abdominal, I can tell that there is no lesions, no bruises, or any abnormalities. And first, I'm gonna start by listening, by auscultating, and I'm gonna start at the right lower quadrant. And I'm gonna listen to 5 to 35 clicks, and if I didn't hear any, I will listen for 5 minutes. And I did hear some vowel sounds, so that is normal. Okay, and second, I'm going to percuss, and when I percuss, I should hear timpani. And I did hear timpani. And last, I'm going to do light palpation. Check for any masses or abnormalities. And there is no masses or abnormalities. Okay? All right. And we're all set for the head to toe physical assessment.